Hi, I'm Dr. Larry Weiss with Weiss ENT, and today we're going to talk about snoring and sleep apnea. So let's talk about sleeping and snoring. What's going on? When we sleep, there are different levels of sleep. The lightest level is level 1, and as we descend into deeper levels of sleep, 2, 3, and 4, our body, the muscles of our body lose tone, including the muscles that keep our throat open. So as we descend into the deeper levels of sleep, 2, 3, 4, and then the deepest level, which is called REM sleep, our muscles lose tone. There's a natural collapse of the airway to some degree in everybody. In most people, that's not a problem, but in a lot of people, there's too much collapse of the soft tissues in our throat, and those tissues fall against one another. But in order for the air that we're breathing in to get where it needs to go, those tissues need to open up. And then they fall back against one another and they vibrate. And that's what snoring is, the vibration of soft tissues against one another. There's a spectrum of snoring. On one hand, there's what's called benign snoring, where although the individual is snoring, they're still able to go through the full night cycle of sleep and get a good night's refreshing sleep. And in that case, it's more of a social issue, the bedmates having to listen to the racket. On the other end of the spectrum is where snoring is a symptom of a real medical condition called obstructive sleep apnea, where at some point in that cycle, the tissues are falling against one another to such a degree that the airway is not opening up and it stays closed. And that's when the bedmate will say that the person's gasping for air. The person will wake up all of a sudden short of breath, trying to recover from not breathing. And that's a real medical condition that we'll discuss a little bit further.